There are growing concerns about the long-term effects of the COVID-19 virus to our hearts. An alarming new study found that infection from the virus appears to significantly increase the risk of heart disease for up to 3 years. This is especially alarming as cardiovascular disease in the U.S. affects nearly half of all U.S. adults. Here to discuss this and our other health headlines is internal medicine specialist and founder of Modern Medical, Dr. Tania Elliott. Dr. Elliott, welcome to the show.
Good morning. Thanks for having me.
Of course. So let's talk about this study. It's by the National Institute of Health. It found that infection from COVID-19 in the early days, which a lot of people were infected with the early virus, it increases the risk of heart attacks, stroke, even death. You saw the study. What do you make of it now?
I'm not surprised by these findings because we did find during COVID, when people had COVID, it wasn't just a runny nose, congestion, and flu-like symptoms. They also were in what's called a hypercoagulable state. What that means is our blood was super thick and more prone to clotting. I don't know if you remember in the very beginning of COVID, we were talking about things like COVID toes, where people's toes were turning purple. This is because our blood was more prone to clotting. So when you think about what happens when you have a stroke or a heart attack, your blood is super thick, more prone to clotting. It blocks off the arteries, and then you do not get blood to the heart. So I'm not surprised that we are continuing to see these after effects. Why is it 3 years, or we're seeing the symptoms for at least 3 years? Because we had COVID in 2020, right?
Sure.
So it's 3 years later. I suspect that we are going to have a prolonged impact of this.
Is there anything our viewers can do to protect themselves from this?
I think it's the first thing that's really important is if you've switched doctors, you want to make sure that you let them know that you had COVID, and not just COVID, a severe case of COVID, and help them understand that so it's part of your medical record, because that might impact your risk. You may need to be put on an aspirin, for example. They may want to be more aggressive with some of your cholesterol lowering medication. So I think that that is the most important thing, is continuity of care if you've switched doctors, and being very vigilant around the screenings and any medications you may have been placed on to continue on those medications for your heart.
Let's pivot to another study, Doc. It's making headlines. The CDC, this was interesting to me. It found that more than 15 million adults in the U.S. have ADD. ADHD, I should say. Now, the study also found that adults struggle to access treatment. I'm curious here, what makes an adult diagnosis so much difficult? Is it just better technology? Are there just more diagnoses now than when we were kids? What's the reason for this increase?
Yeah. Oftentimes when we see an increase, it also has to do with raised awareness. So we didn't really talk about ADD that much when we were kids. I'm sorry, I might be dating myself, but we didn't. So, anytime there's more awareness, there are more diagnoses. So that's one factor. When it comes to ADD in adults, so it is a little bit harder to diagnose, oftentimes because it might be mistaken as depression. It might be mistaken as anxiety. We also are drinking alcohol, marijuana, potentially other drugs. So that can really confound this and make it a little bit harder to make that diagnosis, but it's real. It is an inability to pay attention, sometimes excessive talking. You have a difficult time completing tasks. But the truth is, when we're living really busy, stressful lives, sometimes that's also, just a factor of environment and what's going on in our lives. So again, is there underlying condition, or could it be our environment, or quite frankly, a little bit of both?
There's another study. This is a little scary, a little gross. It says you should change your bathroom habits because 600 viruses were found on toothbrushes and shower heads. I'm not surprised. I'm grossed out. I'm not surprised. What do you make of the study?
Okay. Well, first of all, if you think about the shower heads, and this is a great picture here, there's water, right? And so there ends up being mold and viruses that are growing around it. And who really thinks very closely about, let me go and scrub my shower head, right? You want to scrub the tub. And a lot of the cleaning products out there are scrubbing bubbles and making sure that you're cleaning the tub, and no one's actually looking at the shower head. So this is a pretty easy fix. You want to just make sure that you clean your shower head. You can even use a little bit of bleach, and you want to do that regularly, and then let the shower water run. And you also want to make sure that everything is completely dry after you leave the bathroom. As it relates to the toothbrush holders, man, they also contain a ton of viruses and bacteria. I just need to tell everybody, this is a public service announcement. Make sure when you flush the toilet, you close the toilet seat. Why? Because a plume of fluid can come up in the air and move up to 6 feet. So it's not surprising that there's stuff that's getting all over your toothbrush holder, and whoever thinks to wash those things. So my recommendation is just take your toothbrush holder and throw it in the dishwasher once a week.
Thanks for watching. Go to joinnn.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.